I'm taking you through this, how we prevent this airborne transmission, or how we can prevent our ventilators, or how can we effectively prevent our ventilators for the prevention of airborne transmission. Okay, so I'm Ankit Gupta, taking care of anesthesia and ventilators in Mindray India. So because the main challenge for healthcare workers is respiratory hazard, because this WHO also declared this a pandemic situation after healthcare workers are at risk. Earlier it is from this epidemic. So it is very much for us to prevent healthcare workers from respiratory hazard because for the airborne inhalation and droplets from an infected person. Okay, so these are three types of grades of PPE which already discussed in details. So what type of grade 2 or 3 or 1 we use, which type of therapies when we treated the patient in COVID-19 situation. Okay, as for from mild to severe patient, ARDS patients, okay, we can use a normal oxygen therapy. We can use high flow oxygen therapy like HFNC, as high flow nasal cannula. We can use NIV also and invasive ventilation also. Even for severe patient, this external membrane oxygenation machine is also being used. Okay, so if you see grade 1 kit has to be used for normal patient which are using which has to be exposed to normal oxygen therapy or high flow oxygen therapy or NIV. Okay, grade 2 patients which are COVID-19 patients, okay, which are suspected and having positive COVID-19 patient. So you have to use grade 2. And grade 3 PP kit, when you are doing suctioning to a COVID-19 patient, like you are exposed to their respiratory tract basically completely, and in case of intubation, extubation, tracheostomy and bronchoscopy. So you have to follow the highest grade 3 PP kit in that case. Okay, and for the PP kit, this like grade 3 you see, there is a complete description is mentioned how to wear. We already discussed how to wear and how doping and doping. But what take care you have to take on is like disposable caps, medical grade mask, double pair of gloves, and full respiratory protection, and hand sanitizer and complete disposable coveralls. Okay, high flow oxygen therapy, HFNC and NIV, non-invasive ventilation, as per the guidelines of WHO, NHS, or we can say European Respiratory Services, is high risk therapy. Okay, because it is open system, it can leads to with the exposed to the this healthcare workers due to this containing of during coughing and breathing or sneezing of the patients. Okay, but these are also effective for mild to moderate patients, which having not a severe patients of ARDS, which having mild or moderate, we can effectively with this high flow therapy or NIV. We don't need to intubate that. Okay, so in case of you are using a high flow therapy on a patient, so what are the clinical recommendation is you generally use nasal cannula. Okay, but we have to cover this nasal cannula with this surgical mask or a oxygen mask, so that the dispersion. So there should not be any dispersion of this contaminate aerosol or droplets in the environment, which can affect the healthcare workers, or it can be lying on its surface also, on the side surface of bed rails or even ventilators also. So if you use a nasal cannula for a high flow therapy or normal oxygen flow therapy, okay, you have to cover this nasal cannula with this surgical mask or a complete air tightened oxygen mask. Or there are some oxygen tent is also available, you can use that. Okay. Important is NIV. As I told you, it is a high risk therapy which requires extensive prevention to treat the patient, but it is effective also in case of mild to moderate hypoxia or ARDS patient to treat NIV. Okay. So what is the recommendation is you have to use this single ward, or we can negative pressure isolation rooms to put an NIV to these patients. Okay. Important is use dual limb circuit ventilators. It is important you use dual limb circuit ventilator, which ventilators you run on dual limb invasive dual limb circuit on as a NIV. Okay, because the expired gas has to pass through a expiratory filter. And important is all the circuits or filters which are using for a patient has to be disposable, like single use patient use. Don't use reusable circuits. And important thing is use after the connection, used helmet is preferred. Right now, there's a for NIV, there is a helmet is designed for this treatment of patient and followed by full face mask and well sealed mask. Okay, but there is some theories that helmet is preferred by some clinician or not. But you start with helmet, then full face mask and well sealed mask. Okay, so important is use dual limb circuit ventilators, which ventilators having dual limb as a NIV. Okay, because this expired gas must pass through expiratory limb before releasing to the ICO complex. We can see that. And use bacteria filter on both inspiratory and expiratory. And as somebody asked is what type of filter use? Normal bacteria filter, but at the exhalation side, if you use a hydrophobic filter, it is best. If you have a supply of hydrophobic filter at the expiratory side, it is very good. Then this is very important for NIV. Don't use vented mask. Otherwise, because vented mask doesn't have any filters which can like treat the contaminated gas, so the gas is directly released to environment. So you have used a non-vented mask and you are using a bacteria filter at the expiratory, then the gas has to pass through this filter, not through this mask. Okay, so use non-vented mask. And already discussed, use disposable single room, single patient use accessories. Whatever has to be exposed to the patient is highly recommended to avoid any cross contamination. If we need to take for a patient with severe hypoxia condition, if you need to take it to intubation, we can say that, okay, or invasive ventilation, what are the preventive measure we have to take is, first is, because we have to prevent all the three, the operator, the patient and the environment in case of invasive ventilation. So the clinician has to avoid repeating attempts of intubation. Okay, all the grade 3 PP, what we discussed, has to be by the operator also and the assistant who is assisting him. And it is recommended to intubate patient in combination of sedative analgesia and NMD, neurovascular drugs, blockades, we can say that. Okay, to reduce the coughing, the patient having any coughing. Okay, it is highly recommended to use intubation or invasive ventilation in negative pressure wards. The wards or negative pressure, we can say isolation rooms. Okay, so one more important thing is don't, if you are having a ordinary laryngoscope, try to use electronic laryngoscope. It is recommended to use electric laryngoscope because it hits the epiglottis, which may lead to any coughing to the patient. So it is recommended to use electronic laryngoscope. Okay, and your ventilator, if you are using a ventilator for invasive ventilator, it has all the weaning protocols to know at what time patient has to be extubate. So you have to have any complete eye on the patient through these weaning protocols. Important part of suctioning also during invasive ventilation. How we do the suctioning part. So it is completely highly recommended to use the closed inline suction, because do two important things from this closed line suctioning is, because ARDS patient we have to this re-recruiting, we are recruiting the alveolar part. So if we are if we remove the circuit from the from ET tube, what happens is the pressure from PEEP is going to be not maintained as we are maintaining through this ventilator, which has not been maintained, and the patient can be patient can having a coughing also, which you can be exposed to his droplets and aerosol. So it is highly recommended to use closed suction with invasive ventilation, and you do a shallow suctioning type is preferred with a second of 15 seconds. You can do a shallow suctioning. Consensus of infection control for ventilators. Okay, so right now we have summarized what are the thing has to be taken care for infection control of ventilators. So as per the guidelines of WHO, first is recommendation of single patient use circuits. So whatever the patient circuits you are using has a water trap and one-way valve mechanism. Okay. So and one more important thing is it is not advised to routinely change the circuits, breathing circuits on a patient which is having a COVID-19. Okay, unless it is damage or soil, because changing circuit leads to the dispersion of contaminated droplets and aerosol. Okay. Second important thing is ventilator with high concentration of pathogens which may induce VAP. VAP is ventilator associated pneumonia basically. So if there is any condensation or water moisturization in the circuit, you regularly remove that condensate water, okay, by proper putting a ventilator on a standby to suspend from operating prior disconnecting the circuits to prevent this. Okay, if you like any disconnection has to be happened for the ventilator for any mean, you just place the ventilator standby. Third thing is closed suction is preferred. Use a closed inline suction only. Fourth thing is place bacterial viral filter on both inspiratory and expiratory end of the ventilator. Okay. And important thing is if on the expiratory side, it is important to use hydrophobic filter. And when you are using this active humidifier on a ventilator, it is preferred to change the exhalation filter on timely basis, so it will not increase any resistance to the patient, or it will lead to any airway resistance has to be increased. Okay, and follow the guidelines of the manufacturer at what time inspiratory and expiratory filter has to be changed. For invasive ventilation, a heated humidifier with dual heating wires should be used, because otherwise it will lead to a condensate of the water, which will induce, like already discussed, induce a high concentration of pathogens. Okay, so used a humidifier with dual heating wires. Like dual heating wires mean both inspiratory and expiratory of the limb has been having a heated wire to reduce the formation of condensate in the circuits. And if you're using a passive humidification, it has to be like HME with bacteria filter. HMEF has to be used. Okay, if you don't have a dual limb invasive circuit, you can use a single limb invasive circuits, but IV has ventilator this circuit has to have an exhalation. Don't use a vented mask. Use, instead of using a exhalation valve with a filter. There's a filter in between exhalation valve and mask. Let the gas pass through this filter and through exhalation valve to the environment. So we can basically prevent a very large amount of this. We can say that airborne transmission. An important thing is use standby function in the ventilator. If you are using any disconnect from the ventilator for any function, if you need to disconnect from the patient from the ventilator, just use standby. Let the ventilator comes to standby. Then you can operate the patient on the patient side. Okay, because it will avoid any dispersion or contaminate droplet and aerosol in the environment. Okay, what we do after post ventilation, after extubation, what will we have to do in case of ventilator? So ventilator surface disinfection, it is already mentioned how we can disinfect ventilator. So with the help of 75% of hydrogen peroxide to wipe up the external surfaces. Second important thing is breathing circuits. If you are using a disposable breathing circuit, which is highly recommended, it is very good. You just need to dispose of as a medical waste. If you are using a reusable circuit, it has to follow the complete cleaning and disinfect guidelines as per the manufacturer of the reusable circuits. Important thing is gas source. Like if you are using a central air supply, it is already having a filters, that is not an issue. If you are having a turbine ventilators, please check that they have a proper HEPA filter for this air supply. HEPA basically high efficiency particulate air filters. Okay, check for the specification also. I will cover up how the HEPA filter has been classified in coming slides. The important thing is how to disinfect inspiratory and expiratory valves. Okay, follow the guidelines of your OEM how to disinfect inspiratory and expiratory this valves and flow sensors. Okay, if you are having a reusable external flow sensor is connected, clean it through with your expiratory valve. Okay, as per the guidelines. And if you are using a disposable flow sensors, it has to be disposed of after every use as a medical waste. Thank you. And next thing we are covering is how the Mindray having a ventilator solution against this COVID-19. So right now COVID-19 is a new virus. Every day the information is updating and is still under research. Okay. So Mindray SV300 is a frontline warrior against already against so many COVID-19 patients. Okay, it is working as a warrior in this health crisis. Okay, so clinical challenges for COVID-19 situation is first is patient care. okay, how the ventilator should treat the patient, then how it is preventing the infection, and how it easy to use. Okay, so first we got patient care. So Mindray ventilators having all the three therapies, including high flow oxygen therapy, non-invasive ventilator, and invasive ventilator. So all the three in one device for different acuity areas of treating from mild to the severe ARDS patients. So we have a combination of all the three: high flow oxygen therapy, or we can say that high flow nasal cannula, non-invasive ventilation, and invasive ventilation. So which we required for different type of patients. So it is a three in one design. And ventilator, it is available in all the modes, all the models basically. As per the WHO guidelines, to treat ARDS patients, you have a optimal ventilatory supports in terms of modes. So Mindray ventilators having advanced mode like APRV, airway pressure release ventilation, dual level, and you have optimum tools also to treat to support or treat ARDS. So we have a low flow, low tidal volume strategies as a TV oblique IBW, ideal body weight. Okay, we have PV tools to find out optimum PEEP. Okay, we have in our advanced models sustained inflations. Okay, so this is we can say that a recruitment tool to open up the alveoli. Okay, C20 CY is a parameter which can help you that you are not over inflating the lungs. Okay, so it can help with the barotrauma type of conditions. So Mindray ventilators have comprehensive modes and tools in a single ventilator with all the to optimally support ventilation in ARDS. Okay, as per the WHO, which already discussed, you have a complete weaning protocols that you can daily assess for the readiness or of a patient, either it start spontaneous breathing or not. Okay, so to prevent the complication for prolonged use of mechanical ventilations. So weaning tools cover P0.1, occlusion pressure, NIF, negative inspiratory force, weaning this like spontaneous breathing trials, RSBI, rapid shallow breathing index. So Mindray ventilator having all the combinations for the weaning assessment. Okay, so you have completely keep eyeing on the patient when it's going to be patient has to be done on weaning trials to extubate the patients. For infection controls, Mindray SV300 and SV600 models having both the inspiratory and expiratory valve are autoclavals. And this expiratory valve having flow sensor inbuilt, which is a differential pressure based. So both the valves are steam autoclaval as per the like 134 degrees Celsius. So both the valves are detachable and fully autoclavable. Second thing is HEPA filter. I told you as per European guidelines, EN 1822, all these 17 classes of filter as per the European standard EN 1822, there are 17 classes of filters to HEPA, and then very high efficiency of filter is ultra low penetration air, which is U15, U16. We are using H14, 99.995%. That means in every 10,000 of samples, only 5 particles allowed to penetrate, allowed to pass through this HEPA filter of 0.3 micron. So it is very high efficiency filter. And there is one more important thing is you don't need to change HEPA filters after every patient use. It has to be changed as per the service plan only. Okay, which is generally annually you have to change, or after like 5,000 hours you have to replace this HEPA filter. Third important thing for infection control is we have dual limb breathing circuits. So both we are using, so that we should discuss after you having an expiration filter at the expiration site, the expired gas must pass through this filter. So we are using for invasive ventilation, non-invasive ventilation, we are using a dual limb circuit. So this expired filter, expiratory site, will collect all expired gases, secretion, and residuals all accumulate in the filter before releasing to environment. Important thing, how easy to use. So as per the demanding environment health crisis, Mindray SV300 is very much adaptable to these conditions. It is a compact design which having both the high pressure O2 inlet and low pressure, like this can be connected with your oxygen concentrator also. And it is a work as a transport ventilator also, as an intra-transport in the hospital from one ward to another ICU, we can say that. It can be easily as a work as an intra-hospital transport. AMV, Mindray to minimize the human intervention to the like healthcare giver or clinician with the minimize the human intervention with the patient. We have a AMV mode, advanced adaptive minute ventilation mode. So this mode will from control to extubation. Okay, complete from you can say that control to spontaneous. It can run. Okay, with this help of this mode, you can minimize as much as human intervention of the with the patient of the health caregivers. Next important is we have table layout structure, parameter prompts. Like when you set the tile volume, you don't need to calculate what are the other thing has been changed. It will given as a pop up. You will easily visualize how the other thing has been changed. Okay. Color sorted value. The major parameters will be on the basis of colors, like pressure related to one color, volume related to one color, Vini parameter related to another colors. Okay. Alarm is very intuitive. You can easily set your high, low pressure alarm with the help of this indicators. Single display with waveforms and loops. Okay. And there's a visual guided for system check also. And for some, if a technical alarm is there, you have a graphical troubleshoot guide how to this control, how to like troubleshoot that alarm basically. So there's a alarm guide. So Mindray SV300 is a complete solution in terms of infection control, ease of use, and patient care with all the features which we discussed in details. Thank you. We can take questions.
Thank you, Ankit. This was a really great session on ventilation specifically. A few questions from our audience. First one is from Sarat. Can we use BiPAP for COVID-19 patients as a NIV mode?
Yeah, it solely depends on clinician what therapy he has to use as per the patient condition. But you can use an BiPAP as if it is recommended, but with the precautions what we discussed for NIV especially.
Okay. Second question is, can bacterial filter be effective against coronavirus?
Yeah, bacterial filter is very much effective because as for we are using only surgical mask to prevent our basically mouth and ear, nose for a surgical mask it is used. So it is very much effective. It will not allow to pass any virus or bacteria, especially as coronavirus, to the exhalation site.
Okay. Third question is, as per few studies, the death ratio is high for intubated patients with respect to non-intubated patients. So is HFNC the best option?
No, it only depends on the patient conditions because as per WHO guidelines, it has categorized this patient categorized into three. It has to see the oxygen index ratio of the patient, basically like greater than 200 or 300 mg, it has to treat with NIV or HFNC. If it is going less than 100 mg, it has to be intubated. So clinician has to solely decide what therapy has to do on the patient side, independent of intubation or NIV, basically. It's solely depend on the patient condition.
Okay. Thank you, Ankit. Now, Hari, if you are ready, over to you.
Thank you so much.